Taiwan rejects US CDC guidance on 5-day quarantine. Some Omicron cases still infectious up to 12 days after testing positive.
Here's a summary of the article.
Taipei. The Central Epidemic Command Center on Thursday announced that it will not follow U.S. Centers for Disease Control and Prevention guidance on shortened quarantines because some imported Omicron cases have been found to be infectious up to 12 days after testing positive. On Monday, the US CDC shortened the recommended period that asymptomatic people should undergo quarantine after testing positive from 10 days to 5, as long as they wear a mask for another 5. During a press conference on December 30, Philip Lowe, deputy head of the CECC's Medical Response Division, announced that a total of 59 imported Omicron cases have been detected in Taiwan. More than 80% of these cases were detected upon arrival in Taiwan, while the rest tested positive within 6 days after entering the country. Regarding the US CDC's recommendation to shorten quarantines from 10 to 5 days, Lowe said 23 imported Omicron cases have been tracked for more than 5 days. Lowe stated that after discussions with a panel of experts from the Ministry of Health and Welfare's Advisory Committee for Immunization Practices, the conclusion was that if quarantine stays were shortened to 5 days, there may still be a risk of infection and impact on community safety. The experts advised that Taiwan not follow the U.S. guidance but continue to maintain the current quarantine regulations.
This post received a score of 40,000, with an upvote ratio of 91%. Here are the top comments in response to this article.
5-day quarantine just feels like we're starting to throw our hands up and say, oh well, get back to work.
Oh, that's a bingo. Is that how you say it?
It's just bingo.
Taiwan's been responsible about keeping COVID out completely. They already experienced a disastrous screw-up when they shortened airline staff quarantine periods that resulted in a big outbreak this summer. The first time they experienced SARS, lots of people died, and they are taking no chances. My family in Taiwan have been living relatively completely normal pre-pandemic lives in Taiwan other than mandatory masking outside and in. I'm pretty envious but glad the government is truly keeping them safe.
Greater than the first time they experienced SARS, lots of people died, and they are taking no chances. This pandemic has made it really apparent which countries paid attention and learned their lessons from SARS, and which ones didn't. Granted, the countries that learned tended to have first-hand experience, but still.
In the US, people don't care that so many people died.
Don't care would be an upgrade.
Just came from an sports thread about how the NBA and NFL caved. The comments. You're right, not caring would be an upgrade.
To be fair, the USA is not a good role model for managing the pandemic.
Yeah, please don't use the US as a role model. Sincerely, an unhappy American.
If anything, we should use Taiwan as a time model. Their numbers have been astoundingly low throughout the pandemic.
New Zealand did a brilliant job with it. That's who countries should be looking to emulate. Edit, it's been brought to my attention that New Zealand emulated Taiwan's approach. Makes sense.
New Zealand's Prime Minister has said from the start that they're literally just copying Taiwan's model.
Oh, interesting, I didn't know that. Thanks.
Wearing a mask for 5 days, after isolating for just 5 days, to minimize infection is kind of admitting that you're still infectious.
To be fair, they admit that you are still infectious 5 days after catching COVID, just that in the later stages you spread minimal amounts of the virus, so if you were careful enough the later 5 days then you cannot infect anyone. The problem is the last part. I guarantee that most people and businesses will instead treat day 6 to 10 COVID patients as completely clear, and these people will continue to spread the disease.
This is based on data. I think they are probably cutting it close, especially for unvaccinated, but it's not just a random idea.
This video was automatically created by Reddit to speech. The article and comments in this video were selected from Reddit according to their upvotes, and any paraphrasing was performed by smmry.com, without any human intervention.